Hello and welcome to another episode of Senior Spot. Today I'm so pleased to have with us Terry Enos, and she is the director of not one but two of Emerson's Real Gems, the director of rehab services and the director of the Dr. Robert Cantu Concussion Center. So Terry, welcome to the show.
Thanks, Jen. It's great to be here.
Well, I'm thrilled, and I know the audience will be as well, because not only are you in charge of a very important, important service here in Westford, but you're also a longtime resident.
I am. I've lived in Westford. We moved out here from California in the 70s.
Great.
Westford Academy graduate.
and your children went to Westford Academy.
They did.
And now you have a grandchild in town as well.
I do. Best thing ever.
Oh yes. So it's exciting because I think our audience loves to be able to learn about services, but also from the people that are living right next door, and knowing that you're in charge of these two facilities is quite impressive as well. So tell me a little bit about your role, and I know that it might be different in the two different sort of locations or facilities that you you have.
Well, as I started at Emerson, gosh, it's probably been 16, 17 years ago now, as a physical therapist when they opened the Westford site. So it was a tiny little clinic then, and over the years we've just kind of expanded, and now here I am as the director and helping Emerson support its mission to be part of in the community, keeping people well, and being part of that whole vision.
And it certainly is not tiny at all anymore.
No, not at all.
It's quite an amazing facility. And that's right here in Westford. And then the Concussion Center. Tell us, about that location and what you're doing and what you're overseeing there.
So the Concussion Center is extremely unique, and it's something I am super proud of. We work with Dr. Cantu, who I call him our national treasure. He's just internationally known for his work on concussions. And we have a real brick and mortar center in Concord that is right within the same walls as our rehab center. And it's really, the practices are married. So we really have a medical practice that collaborates extremely closely with our rehabilitation.
Oh, that's great. I mean, having two things in one place, and then having your other site here in Westford being able to deliver all of the services for the rehab and the sports therapy. And I've had the pleasure of having Julie Lorden on as a previous guest, who is one of your physical therapists there, and talking with her and a patient that has had great success, overcoming a stroke at a young age too. So. I do know a little bit about it, but I just know that the audience would love to know even more about, what types of things does the rehab and sports therapy location focus on?
So I could probably spend our whole time talking about that.
I guess in a nutshell.
In a nutshell. So I think just to paint kind of a broad brush stroke, the outpatient rehab or the rehab center is physical therapy, occupational therapy, and speech-language pathology. And when I think about those three very interconnected disciplines, it's really, we treat the human condition. And when I think about what it means to treat the human condition, it's really about movement, functional, and the social engagement. So that's really kind of in a very broad manner what we treat. We treat cradle to grave. Infants, kids with that are on the spectrum, developmental delays. We treat oncology patients because we know that part of survivorship is exercise. Exercise is very prescriptive, and you really have to know what you're doing when you're working with our patients. Parkinson's, movement disorder. We have such a unique setup, particularly where we're part of Emerson Hospital.
Absolutely, and I know that obviously, you're always looking to improve, and there's, new and the latest and greatest, advances and equipment and things. So can you share a little bit about some of the new, advancements and therapies that you're introducing to your patients?
So when you think about rehab, we're really kind of the down and dirty sort of things when it happens in a hospital, because if you think about the lab or the ED or our OR, that's where you're talking high tech. So rehab is really about the staff. and about our relationships with our parents. You know, for example, I've got a couple of our very high-tech pieces of equipment here. We have this really fancy tubing. But the reality is that the advances in rehab we're moving more towards active recovery.
Excellent.
And less away from passive modalities. So when you come into therapy, it's about that relationship that you build with your therapist. It's about the education piece, and again, treating the human condition, movement, functionality, staying in your home as long as you can,
Sure.
being safe, and the being able to be social. So that is really, the advances are active
Are
recovery.
based on relationships.
Well,
So
and it's the active recovery piece. It's
Sure.
it's the prescriptive exercise
to
piece.
keep moving through
Correct.
an injury, to
Correct.
keep moving through things in
Yeah.
order to regain what it is that was potentially lost and to recover from that. So I
Absolutely.
mean, old school, back to basics.
Old
Those are the
school,
things
back
that
to
work.
basics. It works, and massage has its place. Heat and cold have its place.
Sure.
But you can do your hot and your cold at home. And we're really working towards evidence-based practice. We're very deep into understanding what the latest research is.
Great, and that's probably what I meant more about the latest and greatest. It really is the information that you take and the educational pieces that you're always staying on top of, and having your staff be able to then, obviously share it with the patients and keep them motivated. Because that's a big part of it too, is keeping people motivated. It can become very discouraging as you're going through this. So it's, having someone who's, your coach and your cheerleader at the same time.
At the same time, exactly.
And I know that from, meeting various therapists there, it certainly that describes them. I think those two words kind of wrapped up nice and neatly. But you mentioned your staff. I'm bringing up your staff. So tell us, how do you find these great people? Because it's not easy finding people that are always going to be in line with your philosophy and your mission, and staying on top of things as far as their education and and whatever is the most recent research. So how do you find those people? And I assume once you're found, you don't leave. You've been there 15 or 16 years.
Yeah, they're trying to get rid of me, but they
No,
can't.
no, I don't think that's the
No, I'm
case at
kidding.
all.
So I'm really glad you asked me that question, because I get really excited when I get to talk about the staff. You can have all the bells and whistles that you want, but unless you have the right staff, it's not as impactful. And our therapy staff couldn't do what they do, of course, without our support staff. So the whole team is so important.
And what do you mean by the support
So
staff?
the people that are our front desk coordinators who are answering our phones, our insurance coordinators who make sure that the patients have insurance coverage and their authorizations are in place. It's so vital. Our rehabilitation aides who help therapists out in the gym or cleaning the back rooms. The therapists can't do what they do without each and every one of those people, and including our supervisors and managers. They have just an incredible team. I think using the term best and brightest, it's overused.
So what words would you use?
Right. So do I have the best and brightest? Yes, but I think again it loses its impact. So I have really a team of dedicated professionals who come to work every day and are able to tap into their passion. And the passion comes out in the best patient care.
And those that I've met on your staff, it certainly seems like they're the type of people that wake up and look forward to going to work every day, the challenge and helping people get back to their baseline, or maybe even better than what they were, prior to an injury or an illness or, an accident, whatever it might happen to be. So I like that. So they might also be the best and the brightest, but what they bring is the passion, and they bring the knowledge, and they bring that they really want to be the cheerleader and the coach at the same time.
Right.
Which
And
is
they
great.
come to work, and it's fun, it's challenging,
Sure.
but again, it's about being able to tap into their passion.
So there are many different places to go to rehab or to go to PT. So why would you say someone, besides the exceptional staff,
Right.
Which is very clear, what would be some of the other differentiators, some of the other reasons why someone should and would want to go to Emerson for their rehab and sports therapies?
Well, okay. Besides the staff, I think of course, we have the unique situation where we have all of the resources available to us through Emerson Hospital. You know, we are so lucky to be part of Emerson Hospital, and in a great community setting. I think and then when you get down into the weeds of things, it's like, well, okay, so we've got the hospital, but why the rehab? So over the last few years, we've really developed a collaborative team approach to care. Whether you're coming for, post-oncology or post-concussion syndrome, that's where we're seeing a lot of our growth now. And we can't just say, well, it's just one thing, because we need to treat the whole patient. Mm-hmm. So when we think of a real collaborative care team approach, we are uniquely set up to treat in that method where all of our therapists are under one roof.
Okay.
For example, our concussion center is right there, so we are in direct collaboration with our providers, our nurse practitioners,
Sure.
and our physicians. We have the same relationship with our orthopedic doctors, and it's very unique and very special that we're able to provide that level of care.
So it's very seamless too in being able to deliver, that type of care. And even, there's a lot of other things besides the physical piece of it. There's a lot of the mental piece of it too. Someone going through, some of the emotional, some of the emotional wear and tear that someone takes on and has when they have an injury or an illness. So that's another thing, is that within the same system, you're able to refer or to identify and really get to know somebody, because sometimes those types of things hold back somebody from progressing, physically, as if there are any sort of mental, things that are connected to it. So yes, being part of a big system like that, where it's very, very personalized, but yet you have, like you said, all of the other things at your disposal as well.
I think, we really focus on what matters to the patient. If you had, say, a total knee replacement and I had a total knee replacement, we might not have the same priorities in our life. And I think that's the therapist really can tease that out.
Sure.
And we work with the physicians and we work with the patients, and the patients really are in the driver's seat.
Yeah, I mean, it's individualized. It's not one size fits all, because you're right. Having a knee replacement at 35 is very different than having one at 75. And what you want to achieve and what your goals are and how you're going to get there. And it's nice to have someone listen and not just have a prescribed, checklist.
Right.
Because you're right. Everybody needs something a little bit different. So, in terms of things that are on the horizon, things that you could see, in the future taking shape, either at the concussion center or, just strictly at the rehab and the sports therapy, what do you see on the horizon?
Well, I see a lot of growth, that's for sure. I mean, I think as we continue to expand into the community, it's about keeping people well. Not waiting until we're broken to fix them. And there's no better experts than, the rehabilitation team to really address those issues. And again, treating the human condition. Certainly our concussion center is exploding. In the summer, we will be adding a pediatric neurologist.
Really?
As well as a neuropsychologist. So we're very excited about...
Just to focus on pediatrics in particular.
Correct.
Okay.
So we're very excited about that. We're involved in some research studying on concussions as it relates to rehabilitation.
Okay.
There's a lot out there now, and not just athletes get concussions.
Sure.
It's hitting your head in the home or
Absolutely.
falling out in your yard, or certainly motor vehicle accidents.
Right.
So there's a lot that we're doing in treating the concussions and expanding there.
So could you take me through sort of the process of, I pick up the phone and I call, I need an appointment, for my shoulder. I just had, maybe you're not even haven't had surgery yet, but maybe you're kind of getting there and you need to kind of evaluate whether or not you are going that direction. So from the phone call, what's the process? Because a lot of times people get overwhelmed and they think, I don't even know where to begin.
Right.
So what would be the process? First picking up the phone, obviously.
First picking up the phone, that's very important. Seeing either your primary care physician or your specialist and getting that referral to physical therapy. And oftentimes it will be, we work so closely with so many of the doctors, they know the therapist, and it's, it's a shoulder, evaluate it and treat it. This is what I think is going on. And oftentimes they will use therapy as a tool to kind of differentially diagnose.
Sure.
Do we need all that imaging? Or
Right.
can we work through this without doing that imaging? So they will pick up the phone and they call, and we get them scheduled with the appropriate therapist. And I think that that's one thing that makes us very successful in terms of we're not wasting people's time. You are busy, everyone's busy,
Sure.
and we want to make sure we're getting them with the right specialist. So we have built into our scheduling system our care teams.
Okay.
So if you call and you say, I have a shoulder problem, I need to get in, well, we have an orthopedic care team all set up that our front desk people can just plug you right in.
Okay.
On the first available opening.
Right. So it's not first available opening with anybody. It's with the specialist in the area that you need.
Correct.
Okay.
Correct. And we have a large team of therapists. And it's a lot different than booking an appointment or going into the hospital. It's not like we have an empty bed waiting. You're booking one-on-one with that therapist, and that therapist will see you through till discharge.
Sure.
Which is very unique. And the therapist, once you get your evaluation scheduled, you come in for an initial evaluation. They go through a series of tests and questions, and the history is so important.
Sure.
How did you hurt yourself? And some people, I don't even know. Just woke up
But
with it one
it's
morning.
good for people to come prepared, though, and gather that information before they
Right.
come in, because the more information I assume you have, the better it is to pinpoint, how to be able to
Absolutely.
work with it.
Absolutely.
So, okay. So now I'm in, and I'm going through my motions. And, I assume it depends on the injury or the ailment and how often someone's going in. On average, how long do you typically see people? Does it depend on if it's a stroke versus someone having, a knee replacement, things that are either done on an emergency basis or things that are done on a planned basis? Because you have two different ways that people go in for surgeries typically, planned or
Right.
an emergency crisis.
Right.
So about how long do people usually stay in rehab?
That is a good question because it really does depend on the diagnosis.
Okay.
So, and oftentimes people will come in. Now, for example, if you've had a stroke, those folks might come in and they might need all three disciplines. Well, the notion of doing all three disciplines at the same time can be overwhelming.
Oh yeah, it's
So
exhausting.
It's
I'm sure.
exhausting.
It's
and
a lot of work.
It is a lot of work. It's a lot of work for the patient. It's a lot of work for the family members and caregivers. So we really try to work with the family and sort out, okay, what are the biggest barriers right now to this patient's recovery? Let's address those first. And that's why the care team model is so critical to best patient outcome, because the team will get together and say, you know what, we really feel like ADL training, so in other words, being safe at home,
Sure.
within the home, and is important right now. Let's get them with occupational therapy, because maybe that shoulder pain can wait a little while. So that's how the care team model
that's
will work.
phenomenal. That is so nice to hear, because so many things are disconnected, and so when you have that disconnect, not everybody's not on the same page, and you're not going to get someplace as quickly as you want to. And I love the idea of speech, OT, PT, all being able to come together and prioritize things for folks, which I think sometimes when you're having rehab and you need 3 different types of rehab, you may not be getting it from the same source, the same location. So then how does it stay organized? It can't, as streamlined as you can then do it there.
We try to keep it seamless.
Nothing's ever always
Nothing's ever
seamless.
perfect, but we work very, very hard. And I think that goes back to the staff in terms of the people that are picking up the phones to the scheduling. One of the things we recognized with our concussion center was a lot of the folks that need rehab with post-concussion syndrome, they have cognitive issues. They're having a lot of trouble organizing their day. And so what we've started is we're calling her a patient navigator. So when the patient is referred from the concussion center, they literally can walk right across the lobby and schedule their rehab appointments, but oftentimes it's overwhelming for them.
Yes.
So our navigator will get all their information from them, what times are good, what days, that kind of thing. What's the priority based on the provider? In other words,
Excellent.
we really feel like this patient needs PT first. That navigator will then go and work with our front desk staff, schedule the appointment, and call back the patient.
That's so important, because I know when I go to appointments and I'm not even facing the challenges that you're giving as an example, it's overwhelming, and you can't remember, well, should I be doing this first or that first?
Right.
So that's a huge help to have someone coordinate, the services.
So we're getting some good feedback on that.
Oh,
And it's
I
just
love
something
that.
that's relatively new, but I think it's a great kind of little pilot. I don't want to call it a study, but it's a little mission that we're trying, and it's working out very well, particularly for this population who is just struggling.
Absolutely, and with folks with memory impairment, or just not being able to have organizational skills, maybe due to an injury or an illness, whether it be a stroke, whether it be traumatic brain injury, whatever it happens to be, it's very difficult to keep things organized. It's difficult to keep things organized in general. Never
in my
mind,
life, right?
Never mind in this way. So I just love, you just exude such pride in your staff, and I love that, because and I know that the folks that I've met really enjoy working there, and clearly that comes from the example and the way that the person that's in charge as the director feels. Give me a little tour of what your typical day is like, because you're overseeing all these wonderful things. What's a typical day for you like?
My days are,
besides coming on a show like
right,
this.
I know. My days are really, every day is different.
Okay.
We laugh a lot. And it sounds funny coming from a healthcare, where healthcare is very complicated, but we really, when you boil it down at the end of the day, it's about the patient, and it's about our staff, and they're passionate, I'm passionate, and it's we troubleshoot. If a problem comes up, we troubleshoot it, but it's really it boils down to what is going to be best for the patient.
Yeah. And you have to laugh.
We laugh a lot, which is great. Yeah.
You do.
Yeah.
Because you're overseeing quite a few things going on, a lot of moving parts, a lot of wonderful things that obviously are being facilitated under your, under your direction. So you probably don't see it, but it's very clear and evident to me that everything that you put into place, and your staff is able to execute, really does help the entire person. Because it's not just that one single part of their injury, it's usually then the domino effect of other things that happen as a result of the injury. So it's very reassuring to know that everyone's keeping an eye on, what it is that needs to be improved upon, and removing the obstacles that are potentially going to get in the way. So who would have known when you moved here? What, in 1979? Did you say 1978?
Well, maybe a little earlier.
Maybe a little earlier. So it's hard to imagine that. Would you have ever thought something like this would be here in Westford?
No, because I think when we moved here, it was pretty much apple farms and maybe a turkey farm down there. I'm not sure.
Well, and it must make you really proud too to be out in the community. I'm sure you see people at Market Basket, you see people out and about, and you see them make these wonderful recoveries, and it must make your heart just want to explode, because it's you have a big part in that, in helping our community to be able to get back on their feet, or back together, however it was that that they were prior. So you should be very proud of that, a Westford Academy graduate in charge of these amazing rehab services and the concussion center. And as a community member, I'm very thankful, having myself and children and people in the community. We're very thankful to have it in the community, so that it is right here, and it's very convenient to be able to carry on with so much of the rest of your life, and still have the best type of care right down the street. So we very much appreciate your leadership and your wonderful staff, and And I know that it's easy for me to make mention of the rehab services and the sports therapy. And you don't have, it doesn't have to all be sports related. It can be anything.
Correct.
And then you know, Dr. Cantu Concussion Center is just, it's really stellar. We're very lucky to have that in the community. So thank you for being the leader that you are, Terry.
Well, thank you. It's my pleasure. This has been fun.
Well, thank you.